thank you also. We come to the next speech. It is a pleasure for me to introduce Professor Reinhard Jarisch. He is regarded as the one who first described the histamine intolerance and is a pioneer in the fields of investigating the role of histamine. So please, Mr. Jarisch.
Thank you, Professor Reitels, dear colleagues. I was asked to give a lecture on histamine intolerance, and here we go. If you are just able to understand English, we have written a book which has been published some years ago. What is histamine? If you come in contact with a nettle, you realize very quickly what happens: erythema, urticaria, and itch. And if you drink a glass of red wine, it might be that you develop headaches, and the cause for the headaches is histamine. The first one to investigate histamine was Wilfried Lorenz. He did lots of studies, and one important study I would like to present. He had a group of 15 pigs each. They received allergies and alcoholic beverage, and one group received a blocker of the diamine oxidase. And what happened, you can see on the left side, all of these pigs developed anaphylactic shock, and 3 of the pigs died. So this shows the importance of the diamine oxidase. Histamine is a very small molecule. The molecular weight is 111, once heard, once seen, never forgotten. Histamine was first described in 1907, and the antihistamines have been developed 30 years later only. Histamine has physiologic functions like the stimulation of the gastric fluid and, what is important, enlargement of the vessels, neurotransmitter, and immune modulation. The pathologic functions are allergy, as we all do know, histamine intolerance. Histamine is elevated in mastocytosis, polycythemia vera, and urticaria, and of course anaphylactic shock, and seasickness is due to histamine. The diagnosis of histamine intolerance, first we see it in especially female persons being 40 years of age plus minus 5 years, and sometimes we may see it after drugs which may inhibit the DAO. What are the clinical symptoms? Headache, migraine, congestion of the nose, problems with the heart, bronchial asthma, GI tract problems, and, as I mentioned before, skin. The skin may show erythema, urticaria, and pruritus. The typical food and beverages which may cause histamine intolerance are, I mentioned it already, red wine, then a cheese like Emmentaler, chocolate, salami, and fish, especially tuna fish and mackerels, and you should avoid tomatoes and sauerkraut. The diagnosis can be done by a blood test where you detect histamine and the diamine oxidase, then you add a histamine-free diet for 2 weeks. You may call it a negative provocation test, and then we do the blood test again. And what is the result? This is shown from 100 persons, consecutive followed, And in the responder group, you see a significant decrease of histamine, significant increase of the diamine oxidase, and in the non-responder group, no change, and clinically no change also. What are the typical pictures? The typical picture is that histamine is normal, but the diamine oxidase is low. It might be that histamine is elevated and the diamine oxidase is normal, and it might be that both are elevated. The dose makes the poison. And often the doctors just determine the diamine oxidase. What happens if you do so? The next picture gives you the answer. A precise diagnosis can only be posed if the diamine oxidase is very low, I would say below 7. But everything else could be histamine intolerance or not. So you have to determine histamine also. The treatment, histamine-free diet, is a first-line treatment. Then you may add potato rice, a diet, and H1 receptor blocker, and capsules containing the diamine oxidase. This is the sheet we handle to our patients so they can follow the diet. Histamine breakdown could be done enzymatically, as I mentioned already, with the diamine oxidase and with oxidation via ascorbate, which means vitamin C. And this is the result of a lab test showing the more vitamin C you add to histamine, the more you see a decrease of the histamine level. And this is the result in mastocytosis patients, where when vitamin C was added, we could see a decrease of the histamine level. Now, which diseases we have to handle? Urticaria. And usually if a patient has urticaria, he gets an antihistamine. It might be that it won't work, then you add a second one, a third, and against the guidelines, you may add up to 4 antihistamines. My proposal is add the diet if you reduce the histamine level and then give 1 or maximum 2 antihistamines, it will be work, and this has been published also. Atopic dermatitis. In atopic dermatitis, a histamine-free diet is helpful in 50% of patients, so it is good to advise at least some of these patients to avoid histamine in food. We all know that bronchial asthma can be provoked by histamine, and one publication I like very much, it's a gender publication, females. The question was, at what day of the period these people have the most severe bronchial asthma attacks, and it's the first day of the period, which means that a patient, a female patient with bronchial asthma, should add more treatment at the beginning of the period. Bronchial asthma and allergen immunotherapy. What we did is there was a blood taking before and after specific immunotherapy. After means half an hour after injection in the upper arm. And what you can see, when you take the blood after the injection of immunotherapy, the histamine level is elevated, the diamine oxidase is lower, and the tryptase is significantly higher, which means if you do allergen immunotherapy, you will run in a histamine problem. The answer is antihistamine pre-medication, which we promoted some decades ago, and the red words just show that my colleagues more and more were convinced to do so, and in the last line, Ulrich Müller did not only support the antihistamine pre-medication, he also mentioned that the result of immunotherapy improves. I was very happy to hear in 2012 the American Academy promoted and recommended antihistamine pre-medication to prevent anaphylactic shock. And this is one study from Ulrich Müller, a double-blind study in bee venom allergic patients, where he could show that if you give an antihistaminicum prior immunotherapy compared to just immunotherapy, then the result is better because there were no anaphylactic reactions after a bee sting, a following bee sting, and in the placebo group, 6 out of 21. Risk factor, histamine intolerance. If you have a patient, and this can happen, being allergic to pollens, house dust, mite, and in addition to that, suffers from histamine intolerance, and you give him allergy immunotherapy, it would not work in 9 of 10 patients. So forget it. First, you have to treat the histamine intolerance, and if the patient is normal again, then you may start with immunotherapy. We wanted to know what happens if we give 75 milligrams of histamine to a normal person not being allergic, and we investigated 10 persons. And as you can see in the red line, in the red bar, that 6 of 10 showed symptoms. So we forgot the idea to make provocation tests with histamine in histamine intolerant patients. And what were the symptoms? You can see the diarrhea is number 1, and nose symptoms and so on. So histamine intolerance, in my opinion, is a minimal variant of an anaphylactic shock. Coming to heroin, we investigated the risk of anaphylaxis in persons addicted to drugs receiving substitutol and methadone. If you listen or if you read in the papers and a patient has taken heroin, then always it's said it's overdosage, which is not true. It's histamine, and they have a problem because they get nausea and emesis and problems with breathing. What is the result? You see a 3-fold histamine level, a significant reduced thiamine oxidase, a significant increased tryptase, and LP phospholipase A also was increased. So in these patients, we have a problem, and just a little bit of histamine will lead to a fatality. Coming to histamine and seasickness. Seasickness, the major cause of seasickness is histamine, and as you can see, about 1/3 of patients being on a ship, even on a big ship, have nausea or vomiting. I owe this picture. This is on the ship, on the sailing ship Alexander Humboldt. You can find that on the back spear too, the green sails and the green ship surrounding Cape Horn. And I'm happy, well, I was happy not to be on that ship at that time. And if you see the list of the drugs which can be given against seasickness, all the red lines are antihistamines. So this supports the idea that histamine is the cause, and you can prove that in animal studies. And then by chance, I read in the book on histamines, there is an inverse relation between vitamin C and histamine. Hello, inverse relation? This is a sensation. If histamine is high, vitamin C is low, and reverse. So the question was, how can we prove that? And the answer is mastocytosis. If that is true, it must be that in these patients, having a high histamine level, vitamin C must be low. In fact, we could prove that. And this was the start to investigate seasickness in cooperation with the German Marine or the German Navy. The patients or the persons had to go in a life raft for 20 minutes, and this is brutal. I tell you, I was the first to be in, but I was not silly. I took vitamin C prior that test. And as you can see, it works. If you take vitamin C, you have the better result than if not. It works especially in those persons who need it, means females and men below 30 years of age. Older men are not sensitive, and this shows on that persons who did not want to stay longer than 20 minutes in the raft because fear of vomiting, they could show with a hand, and then they were taken out, white face, and as you can see, almost all patients or persons being in the raft and left the raft earlier were on placebo, and those on vitamin C were very late, almost to 20 minutes. What we did, we gave them 4 times 500 milligrams vitamin C, and this was published in the Journal of Vestibular Research. And then by chance, I read in a publication ondansetron versus chewing gum, and the final word was the gum was not inferior. And you know, ondansetron is given in patients receiving chemotherapy against vomiting. So now it was clear we have vitamin C against histamine, and chewing gum works also antiemetic, and this was why we developed a chewing gum, and you can buy that in the pharmacy. The name is C-gum. Nausea and vomiting, New England Journal of Medicine, one of the best publications. And what do they say? They say that nausea occurs between the 5th and the 13th week, and antihistamines are recommended at first-line treatment. And this is why they think that human choriogonadotropin is the cause. But if you are Colombo, you have a very precise look at that, and then you will see at the time when the nausea is gone, HCG is steady with 50%. And this means that a hormone is not the cause of nausea. And the answer for that is that after the 3rd month of a pregnancy, there is an increase of the thiamine oxidase 100-fold, and from that time onwards, histamine is no problem for the pregnant person. It was clear that for these persons, we developed a chewing gum containing vitamin C, and the name is pregnancy gum, and you can buy that in the pharmacy. Histamine and headache. Histamine may cause headache, and headaches and migraine have a relation to the period and are rare at the time of ovulation and high during menstruation. And what we did is we asked patients having severe headache every second day to follow a histamine-free diet for 1 month. And at the beginning, you can see 14 times per month, and at the end of 1 month, only 2 times per month, a significant reduction of headaches. This is a nice book from Professor Goebel, and he wrote about pregnancy and migraine, and he wrote, in fact, there is no better treatment for migraine than the pregnancy. Now, in the meantime, you know the answer, because after the 3rd month, you have an increase of the thiamine oxidase 100-fold, and this is the answer. Histamine may cause diarrhea, but we have also to focus that lactose intolerance and especially fructose intolerance may do also. This is now, for me, very important study, risk factor, operation in general anesthesia. And what we expected was that there is an increase of histamine. This is known since 20 years, but obviously it was not read. So, what we can see in significant increase of histamine, what we can see a significant decrease of the diamine oxidase. Why? Because the body wants to decrease histamine. And this study was done with vitamin C and an antihistamine. What we can see is not on this line, the blue line, what we can see is that the vitamin C level is 1 day after operation halved from 8 to 4. And this is the lower normal level, which means you lose vitamin C during operation. And what is the reason? That vitamin C degrades histamine. So what I recommend for operation is the day before operation antihistamine, 1 hour before operation antihistamine, then during operation 2 gram vitamin C, and the day after again. And if you want to do even more, you give melatonin 1 day before operation to sleep better, and it has been shown that you will need less analgesics after the operation. So, mastocytosis patients is well known, have a higher risk for osteoporosis, and therefore it's clear that antihistamine treatment is good for the bone mineral density. Perhaps not so well known, histamine and parodontitis. The histamine level in these patients is elevated due to bacteria in the gingiva. This is a nice picture from Vienna, and the persons on the right side, I think you will identify as Sigmund Freud. And what we did, we checked the histamine level in saliva, and in 4 from 6 you can see massive elevated histamine levels. I'm coming to the end. Anorexia nervosa shows a decreased level of the diamine oxidase and should be treated like histamine intolerance. And histamine has also to do with adipositas. H3 receptor antagonists are a promising tool in anti-adipositas treatment. And as we all know, the older antihistamines like Histamine often led to an increase in weight. Round body is nice. So, to end up, histamine is to blame for almost everything, and to take an antihistamine never is wrong. We published that in Thieme Verlag, and just recently, 1 week ago, histamine intolerance in trias, where you can read all that, what I told you, and this is the end.
Thank you very much, Professor Jarisch, for your very interesting lecture. Especially also for me as an anesthesiologist, I've found new concepts you proposed, so that's very interesting for me. I will for sure try to get more information about this concept. So I look into the chat and I see one question. But that's not concerning the
it's not
topic
concerning
here.
The topic here.
It's a question concerning the MCAS. So I will ask the others whether there are some questions from
no, we do not have any questions from Facebook right now.
Are there any questions from the auditorium?
Yeah. Well, I have a question regarding... Oh, I'm sorry, Mr.
It's not the case.
Not
so
the case. Sorry.
Is Ms. Weyer.
May I ask for the immunotherapy? Do you actually treat every patient with immunotherapy with antihistamines prior?
Yes.
I mean,
yes.
not only the venom,
yes, every patient.
Also the mites and
it's
everything?
mandatory, every patient.
Okay.
The patient is prior immunotherapy, asked by the nurse, asked by the doctor,
okay.
and if he has forgotten the antihistamine, go back, you get an antihistamine, wait for half an hour, and then come again.
Okay.
So we are very, very strict.
Okay.
No exceptions. And the result is we have almost no side effects.
Yeah, that's right. You're right. Mm-hmm.
Because the antihistamine in allergy immunotherapy is like the life belt in a car. You have to use it, and then you will be safe.
Okay.
All right.
So, thank you. Thank you, Professor Jarisch. As there are no more questions, so we will have a break now for about 30 minutes, so you are able to have a look at the words, and we will see again at 2 o'clock for the next session. Thank you very much.